Welcome to Dr. Balga's podcast for the Curious Doc. Today is January 21st, 2026. This video is on a BMJ Medicine article published yesterday, 20th January. Open access. Article is titled Physical Activity, Types, Variety and Mortality. Results from two prospective cohort studies. Why does it matter? Total leisure time physical activity is linked to lower mortality, but the role of specific activity types and long-term variety is less clear. The study questioned, do individual activities and a higher variety of activities reduce all-cause and cause-specific mortality beyond total activity volume? Designed two prospective cohorts with repeated activity measures. The first was the Nurses' Health Study, 1986 to 2018, and the second was a Health Professional Follow-up Study, HPFS, from 1986 to 2020. Participants, 111,467 adults, 70,725 were women, 40,742 were men, free of diabetes, heart disease, cardiovascular disease, free of cancer, respiratory or neurological disease at baseline. Complete 1986 activity data was available. Exposure assessment, biennial questionnaires, median 13 assessments up to 15. Activity dose in MET hours per week. MET equals metabolic equivalent of task. Total MET hours per week summed across activities. The activities were pooled: walking, jogging, running, bicycling, swimming, tennis or squash, racquetball, stair climbing, rowing and calisthenics, weight training, resistance training. Variety score, count of activities consistently performed equal to or greater than 5 flights of stairs per day, equal to or greater than 20 minutes per week. For others, cumulatively averaged, grouped into 5 categories. Follow-up, 2,431,318 person years. Deaths ascertained via the National Death Index or through next of kin. Greater than 97% were captured. Outcomes, all-cause mortality and cause-specific, including cardiovascular disease, cancer, respiratory and others. Statistics Cox models, age as time models. Stratified by calendar, time and cohort, multivariable adjustment for smoking, BMI, diet quality, alcohol, high blood pressure, hypercholesterolemia, social integration, etc. Restricted cubic splines for nonlinearity, and false discovery rate control was utilized. What did they find? Deaths 38,847 total, 9,901 cardiovascular, 10,719 cancer, and 3,159 respiratory, over 2.43 million person years. Total activity, lower mortality with non-linear dose response, major gains in plateau around 20 MET hours per week, p-value less than 0.001 for non-linearity. Individual activities, most were linked to lower all-cause mortality. Swimming was not, p-trend 0.18. All-cause hazard ratio, highest versus lowest. Walking was 0.83, jogging 0.89, running 0.87, bicycling 0.96, tennis or squash was 0.85, stairs was 0.90, rowing or calisthenics was 0.86, and weight training is 0.87. Variety matters. Highest variety group versus lowest had 19% lower all-cause mortality after adjusting for total activity. Hazard ratio 0.81, p-trend less than 0.001. Cause specific with regards to variety, 13 to 41% had lower cardiovascular, cancer, respiratory and other cause mortality, all p-trend less than 0.001. So the best combination was high total activity plus high variety 21% had lower mortality versus low total activity with low variety. Hazard ratio 0.79. No interaction was detected between total activity and variety. Limitations: observational design. It was self-reported activity. Generalizability is limited because it was predominantly white health professionals. Regarding the swimming finding, null association may reflect measurement, dose ranges, or confounding. Interpret cautiously. Regarding variety definition, counts activities above thresholds, does not capture intensity or technique or occupational activity. Key clinical takeaways: aim for guideline consistent volume, but encourage a menu of activities. Practical takeaway: mix aerobic with strength activity with micro activity, that is, running upstairs, brisk walks. Benefits appear with modest doses and then plateaus. So, what is the public health message? Variety is not garnish, it may be a part of the main course. Clinical pearls: dose target. Benefits for major cause of mortality largely plateau around 20 met hours per week, roughly about 300 minutes per week of moderate activity depending on met assumptions. Variety prescription: encourage patients to do more than one modality across the week, example walking plus resistance plus a sport, because variety predicted lower mortality independent of total dose. Small bites to work. Stairs and short bouts count. Variety thresholds include equal to or greater than 5 flights per day or equal to or greater than 20 minutes per week for other activities. Strength matters. Weight training, resistance training was associated with lower all-cause mortality. Highest versus lowest hazard ratio 0.87. Counseling line: pick activities you'll still be doing in 10 years and then pick one more. Eponyms and key terms. These are some eponyms and key terms used in this study. Hit pause and read it at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.